8th of July 2021, greetings from Rwanda's capital, Kigali. This is what makes our top stories tonight. This afternoon, President Paul Kagame held a virtual meeting with Juta Upilenein, EU Commissioner for International Partnerships, following up on the recent EU agreement to strengthen the Rwanda Food and Drugs Authority, FDA, which will further attract investments in vaccine manufacturing in the country. The Ministry of Health has announced that there is irrefutable evidence that the new variant of COVID-19 mutant known as Delta strain has arrived in Rwanda. I welcome you all and welcome to Rwanda Television News with me, Sam Kalisa. On Thursday, President Paul Kagame held a virtual meeting with Juta Upilenein, the EU Commissioner for International Partnerships. The meeting, which was held virtually, comes after the EU last week signed a 3.6 billion Rwandan francs financing agreement with the government of Rwanda to enhance the country's investments in COVID-19 vaccine manufacturing. The agreement will strengthen the capacity of the Rwanda Food and Drugs Authority, FDA, especially in the country's attractiveness for investments in vaccine manufacturing. Except vaccine manufacturing, the RFDA will use the funding to establish a laboratory with the capacity to test drugs, which will put the agency on the international capacity level for drug testing. Moving ahead, on Thursday, Ambassador Mutsindashyaka Theoneste presented his credentials to the President of the Republic of Congo, Denis Sassou Nguesso. President Denis Sassou Nguesso applauded the existing bilateral relations between Rwanda and the Congo-Brazzaville, as well as President Paul Kagame's continued strive to develop Rwanda and his commitment for the betterment of the African Union in general. President Denis Sassou Nguesso stressed that his country is ready to cooperate with Rwanda in boosting economic development between the two countries. After delivering a message from President Paul Kagame, Ambassador Mutsindashyaka Theoneste said he is pleased to represent Rwanda in Congo-Brazzaville, which already has good relations with Rwanda, and assured President Denis Sassou Nguesso that he would continue to strengthen the good cooperation and relations between the two countries. He also will work to improve agriculture and agro-processing industries in the country. He will be strengthened through existing agreement in relations and cooperation between Rwanda and Congo, of course between relevant authorities for the benefit of Rwandans and Congolese people. Ambassador Mutsindashyaka also pledged cooperation in improving the tourism sector in the country. Moving ahead, the Ministry of Health announced that there is irrefutable evidence that the new variant of COVID-19 mutant known as Delta strain has arrived in Rwanda. As Rwanda continues to enter into agreements with vaccine companies to supply the country with doses, the ministry warns everyone to be extra vigilant to the consequences of the new COVID-19 variants are severe. Ethan Toshobia has this report.
Some residents of Kigali believe that while vaccination increases the body's immunity to withstand severe symptoms of COVID-19, they also believe that those vaccinated are much safer from the wrath of the pandemic.
It's good that I'm vaccinated from COVID-19 because if I ever get infected with COVID-19, I would have the confidence that I would not get severely hurt.
On the other hand, those who have not received a single dose of the COVID-19 vaccines also express concerns about the possibility of developing mild and severe symptoms as the number of COVID-19 infections continue to rise in the country. We would like to ask the Ministry of Health to increase the number of vaccines so that many people can get vaccinated and have a better life, and in so doing, life will return to normal. The Minister of Health, Dr. Daniel Ngamije, said that Rwanda is set to receive batches of COVID-19 vaccines in the coming days through the agreements that Rwanda has signed with vaccines manufacturing companies. Some of the doses have already arrived in the country, and vaccination campaigns will continue as more doses arrive.
So we are importing vaccines, and recently we signed contract with Pfizer to acquire 3.5 million of doses of Pfizer vaccine. And we signed also a preliminary agreement with Johnson & Johnson to get this vaccine through African Union mechanism. Those from Pfizer, we expect to get them by end of this year in different installments. Vaccine from Johnson & Johnson, 2.1 million. A portion of it, we might receive it before the end of the year, and the rest we receive it next year.
As the number of COVID-19 infections continue to surge, Minister Ngamije points out that there is evidence that a new COVID-19 mutant known as Delta has arrived in Rwanda. On Wednesday, 16 people succumbed to COVID-19 related complications in Rwanda, the highest number of deaths since the first case was reported in the country in March 2020. Health Minister says the Delta variant could be the reason behind the increasing number of COVID-19 related deaths in the country.
I think one of the potential reasons is that in the region, even worldwide now, Indian variant or Delta variant is really affecting, is the predominant variant of COVID. And it has high infections and it causes severe forms of infection with symptoms and which are severe, high probability of death. This is probably one of the reasons of having an increase of people who died with COVID. I think for the first time since the beginning of this pandemic, yesterday we reached 16 people who died. It's unfortunate, but this disease, I want to call again the population that we should know, should be aware that this is the third wave in Africa and in other continents, of course, but it's clear that it's different with the previous wave that we had.
Minister Ngamije urges the general public to continue adhering to the set health guidelines, as this would be the only way to control the surging number of new infections in the country.
So we should comply with the COVID-19 measures. They are so simple, it's just a matter of being disciplined to agree and comply with these measures. Leaders, families, members, parents, different people in their responsibilities should play their role, because it seems like there are some people who are undermining this disease, which is not correct. When we consider number of cases in health facilities where we treat COVID, serious increase of cases from 1st or 4th June means we should really consider that this is a third wave. We should comply with these measures to avoid that our health system being overwhelmed.
According to the Minister of Health, the vaccination program is currently underway, with more than 390,000 people already vaccinated in Rwanda. Rwanda's mass vaccination campaign will resume this Friday at various health centers in Kigali, and the campaign will be extended to other parts of the country in the coming days, where vulnerable target groups such as elderly people above 55 years old and those with underlying health conditions being first on the queue. Reporting for RwandaTV News, Ethan Tashobia.
Thank you, Tashobia, for that report. Now, still in line with the fight against COVID-19, some residents of Kigali are urging health authorities to put more efforts in testing people for COVID-19 in areas where they live, as it would help to prevent the spread of the pandemic. The Ministry of Health has announced plans on COVID-19 testing within villages and cells in the capital, Kigali. Gabi Muvunyi reports.
Across the villages in Kigali, figures indicate that a large number of residents have tested positive. Charles Kawandana, who is positive and isolated at home and at home-based care, says it is difficult to avoid contact with his family members.
I have 5 children and a wife. When I tested positive, I had to isolate myself from them. But because there isn't enough room in my house, it is not easy. If it weren't for testing within our villages, the virus would really spread.
Valens Mvuyekure, a resident of Nyabisindu Cell in Remera sector in Gasabo district, says his family was being monitored by health authorities after his wife tested positive for COVID-19.
My wife tested positive, so I and my children had to get tested immediately, and luckily we were all negative. They then told us how we have to carry ourselves so that we are not infected.
Many residents point out that without a follow-up of those who tested positive under home-based care, it could endanger the lives of many.
If there is one infected person in a household, we advise the rest to go get tested as well.
It is important to test those who have been in close contact with positive cases and for those who are in close vicinity with those under home-based care, because they could have been infected without knowing. One thing I could say, if someone comes into contact with a positive person, it could be your family member or even your workmate. They should go and get tested in order to control the spread of the virus. The Minister of Health, Dr. Daniel Ngamije, says that those that test positive and have no symptoms should still self-isolate.
People living in the same house, there are high chances that they all may be infected. So we understand that if there is someone in the family who is infected, everyone should get tested. We're going to put more efforts to test within villages and in the cells so that people can know their status. For those who are infected, they should stay at home and avoid movements like going to the market or bus stations or even going on a taxi motorcycle, because they can easily infect other people. The health sector is ready to put efforts in monitoring those who are infected so that they do not leave their homes.
Statistics from the Rwandan Ministry of Health indicate that there are more than 500 COVID-19 related deaths in Rwanda, 58.97% of whom are men and 41.03% are women. Gabi Muvunyi for RTV.
The Ministry of Health and the Rwanda National Police said that Rwandans should not be worried about cross-border truck drivers who might speed up the spread of the COVID-19 pandemic. These agencies confirm that drivers are closely monitored from the time they enter the country until they leave. At borders between Rwanda and neighboring countries, the cross-border movements of truck drivers has continued even during these difficult times of the COVID-19 pandemic. Some citizens say they are worried that, if not clearly monitored, these truck drivers might speed up the spread of the coronavirus. They stop so many times on the way from Tanzania to Rwanda. We are worried as citizens because we're not sure if they've tested negative or where they passed. There are security organs, so I think no one can cross to buy charcoal or rice in these days. We are only selling the stock of charcoal they brought earlier. As you can see, there's only charcoal from Rwanda, which wasn't the case before. The border is secured, and no Tanzanian or Rwandan can cross illegally. Joseph Akumuntu, the executive secretary of the Rwanda Association of Petroleum Product Importers, says that drivers are tested before being allowed to enter the country. Yeah, it happens. Some of them test positive and they're taken to treatment centers. And after, the vehicles are cleaned so that other drivers can continue the work. They are helped so much, and that has eased the transportation of goods. Rwanda National Police spokesperson CP John Bosco Kabera says drivers entering the country are monitored. The first thing is that there is designated places where they're received from and where they sleep. They wait until their trucks are cleared from different centers including Majergwa, Dubai Port and other places. So the police is always there to monitor them, since, as you know, the police is in charge of reinforcing measures in place. The Minister of Health, Dr. Daniel Ngamije, says that after testing truck drivers crossing into the country, GPS trackers are installed in their vehicles so that drivers can easily be monitored.
hasanzwe hariho gahunda yo gusuzuma yo kwakira abashoferi ku mipaka batwara amakamyo binjiye.
There is a way of receiving and monitoring drivers who arrive at the border. We test them and let them in when they're negative. But after, trackers are installed in their vehicles, and so they cannot stop anywhere, anyhow. They only stop at designated places. That is to prevent them from getting in contact with other people along the way. So they have to move from the border straight to the customs office.
kugira ngo aze avuye ku mupaka ajye kuri gasutamo aho bagomba kumwakira.
The Rusumo border alone accounts for 99% of trucks that carry goods to, from and through Rwanda. Between 350 to 450 trucks cross the border every day. Neighbors of COVID-19 patients under home-based care in Kamembe sector in Rusizi district say they are trying to avoid contact with patients to protect themselves from getting infected. However, as Jedu Mwali reports, they would request that everyone in the home of an infected person is tested. There is a growing concern in the area that a lot of people are not aware whether they are positive or negative because they find the cost of testing expensive.
This is the home of COVID-19 patients in Changu Gusau, in which all the 6 family members have tested positive. There are also several patients in this area. Neighbors say they are trying to avoid going to the patients' homes to avoid getting infected. With this virus, one may pass by someone and get infected, visit someone that is sick without knowing and get infected, or simply see a neighbor and get infected. That's why it is best to stay home and not visit anyone. We only do so if it is necessary. People close to patients, living in the same house as patients, or who are in the same neighborhood, say that even though it is difficult, they all have a common understanding. They do their best to protect themselves and allocate patients to their own toilet and bathroom to avoid sharing with others. The only drawback is the expensive cost of testing for COVID-19. A great thing would be if everyone that presented with symptoms tested. However, 10,000 Rwanda francs is a lot of money for one person to pay for a test. We found the health volunteer on their way to check in with the COVID-19 patients. He says that as soon as they found out that someone is infected with COVID-19, they immediately inform neighbors to ensure social distancing and other precautions and teach the infected person how to take care of themselves during this period. The caretaker points out that the only problem is feeding the people in the household as no one is able to work. We visit them regularly. When we visit, we ask them how they are doing, how their health is at the moment, and we give them morale that this is a virus that one can heal from. The biggest problem may be for one with a household where every member is ill. They have no way of getting access to food or even fruits, since none of them can work. The Executive Secretary of Kamembe sector reminds everyone to continue to abide by the measures put in place to curb the pandemic, staying aware of symptoms and being quick to get tested. There are people helping us with providing food to those that have no access to it. There is no way that someone will die from starvation. There are institutions placed to ensure that this does not happen, including the officials of the sector. I also urge people to continue adhering to the COVID-19 regulations by wearing your mask, even at home, in case you are staying with someone that may be infected. If one notices that they are presenting with symptoms, may you be quick to get tested. The report from Gihundwe Hospital shows that Kamembe sector has the highest number of COVID-19 patients under home-based care in Rusizi district, with 51 patients in total, followed by the neighboring Gihundwe sector with 34 patients. Umngari Jade, RTV News.
On Thursday at Kagitumba border in Nyagatare district, 11 Rwandans who had been detained in various prisons in Uganda were deported. Among them, 10 were men and 1 woman who are said to have been tortured where they had been imprisoned for some time after being accused of being Rwandan spies. Jedumwali continues.
1 p.m. on Thursday, 11 Rwandans, including 1 woman, were dumped by Ugandan authorities to the Kagitumba border in Nyagatare district. In order to continue the fight against COVID-19, they were first tested for COVID-19 by Rwanda health officials at the border to see if anyone had contracted the virus before being transported to the COVID-19 isolation center. The testimonies of some of them are not very different from those of their colleagues who have been deported back to Rwanda in the recent past, as it reflects the severity and seriousness of the torture they were subjected to during their detention in Uganda. They hit us hard. One of them would use a long metal cord leaving wounds and then pour a disinfectant on the wound, which was to supposedly heal the wound on the legs. Another would take a single stick and hit me on my butt until the stick was shattered into several pieces. They hit me in turns, asking me what the Rwandan soldiers wanted and with whom I worked with. In the end, I told them I had no idea what they were saying. In the 11 Rwandans who were deported to Rwanda were those who had lived in Uganda for more than 10 years with their families and relatives. They say they are deeply saddened by the property they have left behind, including those who owned factories, and that no information from their families is known to this day. I had a loan of 2.9 billion Ugandan shillings to increase the productivity of my factory. Before this loan, my investment was not below 1.5 billion Ugandan shillings. I urge the Rwandans who go to Uganda to be vigilant. There are people watching the footsteps of Rwandans day by day to give false information, which in the end leads them to problems. The 11 Rwandans, followed by 17 others who were deported from Uganda in May 2021, and others who had been deported at different times after being detained in various prisons in the country as they were accused to be Rwandan spies.
Moving ahead, in Muhanga district, a third-year high school student has started developing robots and now aims at making robots that can be used for medical and industrial use, photography, and more. This teen, known as Victor Emmanuel Ndaisawa, has demonstrated the ability to make a robot that can broadcast messages on COVID-19 preventive measures, especially in crowded places. Gabi Muvunyi has more.
Although he's on holiday from school, we found Victor Emmanuel Ndaisawa at his home drawing and sketching out images of robots. Next to him are complete robots that he built using basic materials. He then goes ahead and demonstrates how the robots work. Victor wants to name his future robotics company after himself. His love for technology began in his 4th year of primary school. It is from that point that he knew his love for technology was a gift from God.
I built my first robot on wheels in 2019. It was my first time building a robot of this nature, and how this one operates is by timing. For example, I can time it to switch off the lights in the next 10 minutes, and the robot switches them off. To me, this is a gift from God, to have the ability to do all of this. When
the first case of COVID-19 was detected in Rwanda last year, Victor developed a robot that could be used to broadcast COVID-19 preventive guidelines to the public, although he did not see the potential of high robots then.
I decided to make this one for the current situation we are in. It will broadcast messages to the public to remind them to keep 1 meter distance, to ensure that they're wearing their face masks properly, and other COVID-19 preventive guidelines. I also built it so that it can be positioned in crowded places in order to alert the public.
The young tech wizard explains that he works on his projects during the holidays, so it does not interfere with his education, as he is in the 3rd year of high school. He would like to study mathematics and science-related courses so he can continue working on his dream of developing robots that would, in the long run, foster robotics development in the country.
If you refer to my drawing book, you can see I have various projects in mind. The robots I can build can help in factories to carry heavy objects. I also have plans to build a robot that can be used in crop fields to spray the crops with insecticides.
His parents show a willingness to continue to help him achieve his dream, but say he needs to stay in school and finish.
If he continues his education, especially with math and science course, it will really help him grow and further his understanding in what he does.
In addition to the gift of drawing and making robots, Victor shares that he also hopes to start writing and acting in films with the help of technology and the robots. Gabi Muvunyi for RTV.
On behalf of the entire news and technical team that made it happen, let me thank you all for being with us. My name is Sam Kalisa. Have a good evening. And of course, remember that COVID-19 is still out there. Observe social distancing whenever in a public. Wear a face mask correctly and wash your hands regularly. Sanitize, and of course, yes, together we can flatten the curve of the COVID-19 in Rwanda. Have a good evening.